Wow, what a day, huh? So, as she said, I'm Alfred Slanetz. I'm chairman of the board at the National Foundation for Cancer Research. And, I think there's a saying we stand where we stand because we stand on the shoulders of giants. And there are so many giants in this room. And, I think should all give an applause, right, for all the wonderful scientists and people that have been here. And for me personally, I mean, Dennis Slayman and Lisa Cousins made HER2 possible and Herceptin possible. And one of my first roles when I went to Genentech was to serve on the core development team, one of 5 people, to develop Herceptin. And how do you figure out how to develop a diagnostic at the same time as a therapeutic? And of course, Herceptin became the first personalized medicine, and choosing the dose for the phase 2, 3 trial. That was a decision too, because we changed the dosing regimen kind of right before that. And thankfully, we chose the higher dose, partially because I went up against a group of people who wanted to choose the lower cost of goods dose, which wouldn't have gotten approved. So I owe a lot of my early work to, these 2 individuals. So it's personally very, very pleasing to see the award go to Dennis Slayman this year, and congratulations. So, really, I think collaboration is really important. And I go to a lot of conferences every year, but this one's different. And it's really the only event that's so intimate where people who are researchers, business leaders, investors, cancer advocates, cancer patients, all come together at the same time to look at these great accomplishments. And everybody comes to work together to do their part in fighting cancer. And really, the leaders from the whole continuum of patient care, of science, of development of products, all come under one roof to find the cure of cancer. And it's about ideas and innovation and what's next in cancer research. And then we have action plans to work together to deliver results for cancer patients. And I think right now we're in a critical moment in the fight against cancer. And I'm pleased to report that NFCR is at the forefront of innovation that will make the cures possible. And, that this really is important right now because the National Cancer Institute had a cut in their budget this year, right? Which is really horrendous. And anybody who's a senator, a congressperson, anybody who knows people really should push to have that corrected before the, I guess, final budget comes through, which probably will be after the election. And I think also, whether you're Republican or Democrat, look, cancer is not political. Cancer is a disease. Cancer affects people with families and everyone else. And we need to fund the work at a much higher level than what we're doing here in the US. And that should be corrected immediately. So I just wanted to say that. So, we're really looking also globally, right? And you heard a lot about that. We're building something called the Global Network to unite our collaborative forces to advance the progress of new and early detection, diagnosis, and treatments for cancer patients worldwide, because it's also a worldwide problem. And this means people in some of the other countries, such as Africa or other countries where there's expected to be a big increase in incidence of cancer, and we need to provide good treatments for everybody in the world because they have families too, and they have the need with growing incidence for what we're doing. So we need to be thoughtful about how do we do this in the communities internationally, the communities that are underserved here in the US as well. And we have many partners and peer organizations here. I was particularly glad to see Marge Foti get the award today because of all the great work that AACR has done, as well as many other wonderful operations. Our nonprofit partners and peers in attendance include the Aim High Accelerator Fund, the Asian Fund for Cancer Research, the AACR, as I mentioned, Precision Medicine Coalition, Drug Information Association, and even the Chinese American Hematology and Oncologist Network. So it's very important from today's talk and discussions that to beat cancer, we have to continue to invest in the basic and translational research that fuel tomorrow's discoveries and new breakthroughs. And we need to invest in early stage oncology companies so that discoveries in the lab actually get to patients, right? Because that's where the translation happens. And, you know, we do wonderful things to develop these great new approaches, and we have a revolution in terms of the molecular knowledge and the cellular knowledge and all this knowledge of cancer, but it really only counts if it impacts humanity, right? And if it impacts patients, okay? And those studies are really, really important. So we need to invest in biotech companies so they don't just lay idle in the valley of death, and these great new technologies don't get at least tested, you know, in an early stage study, but rather advance to the patients at the bedside. And we also understand, and I think it was a theme of today, you know, that we need to take steps to detect and prevent cancer wherever possible. And those two kind of messages lead to a better outcome of patients. Cancer is more treatable early. And this is an early emerging research focus area for NFCR, as we think that the investment in early detection and early intervention is both worth investment and also shows great promise to aid the process of curing cancer. To stop it before it starts is the ultimate goal of where we have to do. And it's going to take, again, more than just the science, which we're really going to. It's going to take rethinking the way we think about healthcare, right? Our mission is really to create healthy lives and healthy outcomes. So patients don't have to go to the hospital. Patients can live their life with their family and doing their job and, you know, doing the things that are important to them and the people they know. And that means that we have to rethink the way we're even reimbursing, right? To cover prevention, cover things that could lead to helping vaccines or early detection, diet, right? I mean, different things that really can help us in terms of this, as well as, of course, breakthrough therapies, right? Which are critical, in particular, once you already have cancer. So on February 5th, 2025, the Kennedy Center here in Washington, NFCR is going to host the Nearness of You, a jazz concert, where we'll have several A-list musicians perform to support our cancer research community and help raise awareness and funds to support early detection and early intervention research, this new initiative. And I invite all of you to save the date on your calendar and attend this important conference. And more information, obviously, will be provided by NFCR in the coming days and weeks. But, you know, I think that's really the next big event, and it's wonderful. We had one in New York last year, and it's amazing, you know, what we can do. And also, please save the date now for next year's NFCR Global Summit and Award Ceremonies, which is October 24th of 2025, here again at the National Press Club. But before you leave tonight, I encourage each of you to scan the QR code on the bookmark at your table to help us continue the mission to make cures possible, because it's really important now more than ever, particularly given the situation that I mentioned at NCI funding, that we fund this innovative research. It's critical that we do this. So I'd like to take this opportunity to thank all of those who have made this event possible. First, I'd like to thank our sponsors, most especially AstraZeneca and OncoC4, and the donors. Without your support, none of this would be possible. And I'd like to thank the NFCR staff for all of their hard work to prepare an event that's unlike any other. Sujan, your leadership, your energy, your passion, you know, it really, the work that you've done to advance NFCR and the mission and fight every moment of every day for cancer patients is really remarkable. You're a force of nature. And you and the team are making a big difference for cancer patients here in the US and across the globe. And, you know, thank to all of you for being here as part of the NFCR global community and network. Together, we all will make cures possible. So with that, the 2024 NFCR Global Summit and award ceremonies for cancer research and entrepreneurship is concluded. Enjoy the rest of your evening. Safe journeys home. And I look forward to seeing all of you again soon at the concert repertoire. Thank you.